Breastfeeding is a physical and hormonal process that involves both you and your baby. Milk production begins in pregnancy with colostrum, and then after your placenta is delivered, it triggers the start of the next stage of milk production. This can be delayed slightly by a caesarean birth or separation from your baby, but it usually happens between 3 and 6 days after birth. The stimulation of your nipples by a baby, a hand, or a pump is an important part in telling your body to produce and release milk. Does size matter? Your ability to produce milk depends on glandular tissue inside your breast, not what size they are. Finding a position that works for your body and baby may take some trial and error, whatever size your breasts, but there are different options for particularly large or particularly small breasts. If you have worries about your milk production, when you ask for support, you may be asked questions about the appearance of your breasts or any physical sensations or changes you may have noticed. During pregnancy, it's normal for your breasts and nipples to change colour, shape, or size. It's also common and normal to have differences between each side, for example, one nipple that is flat or inverted and one that is not. Your breast tissue extends right up into your armpit, so any changes or sensations you feel related to lactation may be experienced there too. Parts of the breast. Areola. This part of your breast is around the nipple. It comes in a variety of colours and sizes which may change during pregnancy. It helps your baby see and find the breast right from birth when their vision is still developing. Montgomery glands are the small bumps around your nipple, responsible for lubrication, and they actually have antibacterial properties. Your nipples. Milk leaves the breast through your nipples, which often has multiple holes. Everyone's nipples look different, and here are some common types. Protruding nipples stick out from the areola, even more in response to cold or arousal. Flat nipples do not stick out from the areola, even when they're cold. They're just as capable as protruding ones for feeding a baby. However, some adjustments to positioning and attachment can make feeding more effective and comfortable. With practice and support, you can find what works for you. Inverted nipples sit tucked inwards towards the body, and sometimes they come out during pregnancy, but not always. If inverted nipples are making it difficult for your baby to attach, there are techniques that can help. As always, with support and practice, you can find what works for you. If your nipples have been pierced, it's recommended to remove jewellery for the duration of breastfeeding. This helps to avoid infection, potential complications and discomfort for the parent, as well as any discomfort or choking hazard for your baby. If you've had any kind of breast, nipple or chest surgery, lactation is often still possible. You may want to discuss this with a specialist in infant feeding before your baby is born. If you have pain or discomfort, any new or sudden changes, you can contact the sources of infant feeding support listed in other videos. Breast health is usually supported via your GP, who can refer you to specialist teams if needed.